Hi, this project was based on the movie A Beautiful Mind and worked on by Sophie, Cindy, and Leslye. For the description, John Nash attended Princeton in order to become a math prodigy, which is when he started exhibiting schizophrenic behaviors, although nobody was aware until the middle of the movie. John Nash's diagnosis was schizophrenic. Schizophrenia is a brain disorder. It affects less than 1% of the population and can cause hallucinations, delusions, and repetitive body movement, which he exhibited throughout the movie. For context, Nash had a schizophrenic break throughout the 1950s and 1960s, and the treatment included electric shock and insulin coma, but this was due to lack of knowledge and experience.
Nash displayed many characteristic symptoms of schizophrenia, including hallucinations, delusions, incoherent speech, and lack of interpersonal relationships throughout the movie. He developed the first symptoms of schizophrenia in the 1950s when he did not respond to social cues and thus did not have many interpersonal relationships. In Nash hallucinations, he worked with Agent Parcher from the CIA, who has recruited him to break codes. He then discovered that not only Agent Parcher a hallucination, but also Charles and his niece, with whom he has maintained a close relationship with. Due to severe hallucinations and delusions, Nash began to distance himself from the real world.
For the treatments, I propose that he should be treated with cognitive behavioral therapy practiced with proper medications. Cognitive behavioral therapy is practiced by a psychiatrist to discuss negative thoughts and current situations to change one's mindset and perceptions. Cognitive behavioral therapy works best with medications such as antipsychotics. These medications, like antipsychotics, will help stabilize the patient's mind and realize the reality. But these medications might cause negative effects. Drowsiness, dry mouth, and weight gain are the common side effects. And even in severe cases, tardive dyskinesia can occur. It is an involuntary neurological movement disorder. Cognitive behavioral therapy includes many different types of therapists. First is social skills training, which focuses on improving communication and social interactions with others. For example, Nash throughout the movie learns slowly how to be a part of community. Through these processes, he learns to determine which parts are hallucinations and which are reality. Next, therapy is social recovery therapy that targets to help the patient set and achieve goals. For example, once he discovers that all of his experiences as a government spy were not real, Nash puts an effort to recover and asks Hansen for a job so he can practice being a part of a society. Setting a goal and involving in a community to successfully complete one's role developed Nash to a point where he once again gets employed as a professor and wins a Nobel Prize.
Nash paranoid delusions were brought to life in the film by depicting a variety of symptoms associated with schizophrenia and mental health treatment. As the disease progresses, Nash moves into a realm of hallucinations, delusions, and social isolation. Since there are no medical tests that can diagnose schizophrenia, it ultimately requires a psychological interview involving close family members for Nash to be taken care of. The film's portrayal of the disorder has successfully raised awareness of the need for holistic schizophrenia management by addressing the struggles that people with schizophrenia have faced. Thank